Hello and welcome to Basic Spanish for OT, PT, and SLP. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP Clinicians in the Acute Hospital Setting. This book, as well as the ebook, can be purchased on Amazon.com. Before I continue, I would like you to do a few things. One, if you like the video, please hit like. Two, if you want to see more videos like this, then hit subscribe. So whenever I upload videos, you'll get information about that. And lastly, tell a friend if you know someone and it doesn't necessarily have to be therapy clinicians. It could be for nursing assistants or nurses or physicians, but it's specifically designed for therapy, the things that we say during our treatment sessions. But if you know someone that's interested in that, they don't have to necessarily be a therapy clinician, let them know about the lessons that we're having here. As we begin this journey, I would like to provide some helpful hints to learning and communicating in Spanish. If you have the book, I'm going to ask you now to turn to page 10 in the book. If you don't have the book, I encourage you to get it. So it'll make it much easier to follow along. So let's go to the first thing. First thing, in the book, you'll notice that I did not complete the book. And I say this here in page 10 because your learning is going to come from your participation. Spanish, just like anything else that we learn or learning a new language, whether it be Spanish or anything else, it's not a situation where someone can just open up your brain and then pour everything in and that's it, you're done. It's going to be a day by day by day. The same thing that we tell our patients, that their progress will depend on their participation. That's the same thing with us when you're learning a second language, especially as learning as an adult. So that's very important. Practice, practice, practice. The second hint I want to give you is that you should connect the Spanish or connect learning Spanish to something that you're already doing. Many of us are busy as adult learners, whether we have a family or not, we have lives. So sometimes it's very difficult to carve out time to say, oh, I'm going to take this hour and learn Spanish. So one of the things that we encourage is that we tell you, if you go up the stairs every day or you brush your hair every day, when you're doing it, when you wash your hands every day, connect that to learning Spanish. So let's do something simple as learning numbers. When you wash your hands, we know we generally encourage people to wash their hands for at least 15 to 20 seconds. That's great to learn the alphabet. That's great to learn some numbers. So every time you wash your hands, to make sure you do it for 20 seconds, you can count. 0, 1, 2, 3, 4, 5, 6, 7, and so forth, so on and so forth. So that's important. That's a good way to be able to incorporate learning Spanish into something that you're doing already. You could go up the stairs, brush your hair at night, whatever your routine is. The second thing, or the third hint, I guess, it would be use every opportunity to practice your new learning. I have this in the book. You practice makes permanent. So that's my statement. Most people say perfect, but practice makes permanent. The more you practice, the more you practice, the more you'll learn. The other thing too is when you are communicating in Spanish, because you won't be fully proficient with it at first, use visual cues. Visual cues are very important, whether it's Spanish or any other language. If you're wanting something or you want a patient to sit down, then you can, even if you don't know officially how to say it, maybe you just remember siento, something siento, I don't know, something siento. But if you're pointing to the chair and you say that, they're going to get the idea, they're going to get the understanding that you're asking them to sit down, okay? The last one is there is no translation in the book, and I put this down here specifically. There's no translation included in the book for procedures that require signed consent or for something that is elongated, something long statements that you want to be able to make. The reason for that is this channel, the book, the ebook, was not designed to avoid using a certified Spanish interpreter. I encourage you, I really, really, really encourage you, use the interpreter if you have it. But this was designed to be a tool in the therapy clinician's toolbox, because there are times when we may not have an interpreter available. So at least you have a little bit of a help. You have some help there. But I implore you, use your facility's protocols when you are working with clients that don't speak English or have difficulty speaking English. But this is just used as a support for you. Laugh at yourself. If you turn to page 11 in the book, I encourage you to laugh at yourself. Now, I didn't put this in the book, but you get this. The first time that I was learning Spanish, I shouldn't say the first time, but when I was first learning Spanish, I remember being in New York, where I was born and raised. And a friend of mine in Spanish, we were communicating in Spanish, and she asked me to go to the store. And I said, I can't go to the store, or at least I thought I was saying, I can't go to the store because I don't have an umbrella. She started to laugh, but not in a way that was demeaning, in a way of kind of teasing. And I said, what am I saying wrong? And she said, no, Juanita, you're not saying you can't go to the store because you don't have an umbrella. You're saying you can't go to the store because you don't have an erection. So after that, I as they said, I died. That was it. What more could I say? Okay. So, you have to laugh at yourself. You are going to make mistakes on this journey. I don't know if your mistake will be as bad as mine, but you're going to make mistakes. You're going to say a word oh, that's the wrong word. You're going to forget. It's going to happen. But if you're going to get better, one of the things that I tell my patients is if you're going to improve, you have to be willing to fail. Because if you're a perfectionist to the point where you are not willing to fail at anything, then you probably won't do too much. So I just want to encourage you with that. And then lastly, we're ending on page 11, enjoy, relax. When we're getting patients up for the first time, getting them out of the bed. I'm a clinician at the hospital setting in a Trauma One hospital. So often we're getting patients up for the first time and they are nervous as all get out. But one of the things we encourage them, try to relax, calm. We use therapeutic use of self when we're working with our patients. So I implore you, relax, laugh at yourself, and enjoy the journey. On this video, as well as the last one, I didn't start with any Spanish. So hopefully in the next video, I think I'm done with the introductions. On the next video, we will start with actually learning some Spanish. But thank you. Gracias. Adios.